This is Uprising. I'm Sonali Kohatkar. While the crisis of Ebola has slipped out of the headlines in West Africa, the numbers of fatalities from the deadly disease continue to rise, at least in some countries. Sierra Leone, in particular, has been hard hit with hundreds of new cases in the past week alone. Mali has now reported a second Ebola outbreak after beating back its first. Overall, there have been at least 5,147 deaths attributed to Ebola. Aid groups and governments are fast-tracking clinical trials of drugs in order to get the high fatality rate under control. 50 to 70% of those who contract Ebola in West Africa die from it. Médecins Sans Frontières has taken the lead on 3 different clinical trials. Now, the standard practice in testing new drugs is to administer them to a group of patients and then give the control group placebos. But because of the emergency situation, all patients will be given the actual drugs. Now, meanwhile, nurses and health workers who are on the front lines of the epidemic are up in arms. In Sierra Leone, hundreds of workers went on strike at a clinic protesting low pay. And here in the United States, where there have been only a handful of cases, a 2-day strike this week by tens of thousands of nurses took aim at the inadequacy of their training and equipment in dealing with Ebola. My guest is Rishi Manchanda. He's the president and founder of Health Begins, and he's a physician who has worked for years in South Central Los Angeles. He's also the author of the book, The Upstream Doctors. He joins me in studio this morning. Welcome to Uprising, Rishi.
Thank you, Sonali.
Thanks so much for joining us. Well, what do you make first of these clinical trials? MSF has taken a serious stand. They've been on the front lines of this fight in West Africa, and they're pushing for these trials without control groups. But this is risky, of course. If there are side effects that end up doing more harm than good, there's a major question of ethics, and people could die, but people are dying anyway.
I'm glad you brought up the question of ethics, especially in a crisis moment that we're in right now with Ebola. You mentioned the case fatality rate right now being from 50 to 70%. So let's keep in mind the environment and the context in places like Liberia, Sierra Leone, and Guinea, the 3 most hardest hit countries right now. And think about that question of ethics. The World Health Organization and a host of others actually put together an ethics working group, and it's a long-standing infrastructure to think about questions like this about therapeutics, not just medications and trials for public health crises, for emerging diseases like Ebola, but also for vaccines. And one of the things that emerged out of this process, which I should stress is a process that has included representatives from the hardest hit countries, from Guinea, Liberia, and Sierra Leone, that's been going on for several months right now, has been this emergence of a question about ethics. And what's guided this is the realization that, A, in a moment where there are fatality rates that are this high, is it ethical, for instance, to come into a community and say to a certain set of patients in a clinic, you get this drug and others will get a placebo? In an environment where healthcare workers are actually being assaulted and murdered because of the crisis that's at hand there, and more importantly, in an environment where resources are so scarce, where there's such incredible limitations right now on the systems, the stuff, the staff. In that environment, is it ethical to actually go into a community and say, we'll provide you with, some of you with an experimental drug, knowing that others will receive a placebo? The question, of course, is then, is it going to be effective in identifying information, and revealing what works and what doesn't? And it's important, I think, at this point to go back to the science and realize that while the gold standard is placebo randomized control trials, where one group gets an intervention, the other doesn't, there are other scientific methodologies that have been used for a long time, for instance, with cancer trials, wherein one group of patients can receive one experimental drug that has already gone through phase 1 safety testing, and another group receives another experimental drug, so that there's still therapy being provided, both experimental.
Right.
But the question then becomes, how do you compare a group of patients to another group of patients, both of whom are receiving this? I think it's also important to go back and look at the specifics of what MSF is doing right now, and I think what they're doing is taking into account all the complexity of what's happening on the ground and doing so in an ethical way that is keeping, to my impression, keeping in line with what is fundamentally important, which is the autonomy, self-determination of the communities themselves.